also have elections for like Red Oak Chamber Board elections coming up. I think that starts this coming Monday, the 2nd, and then it goes for 2 weeks until Friday, the 13th. And there are 9 people on the ballot. You can pick 5. And all we do, I think, is send an email to Clint to say who the 5 that we're wanting to be selected are on there. We also have the online auction. This is our last event of the year. Clint is going to talk a little bit more about that, but that also starts a week from tomorrow. It's going to be Thursday the 5th through Sunday the 8th. So I just encourage you to participate. You can share this out to other people. It could really be all over the country. They will ship the items anywhere. And the last thing I want to mention is the next month's luncheon is on Wednesday, the 18th, and it is going to be Clint and myself and Beth, who is on here, who is going to be next year's chair, talking about this past year and just the upcoming year too. So with that, back to you.
All right, perfect. Well, I'm going to go ahead and jump right into everything now.
Hold on.
This is a unique month because our luncheon speaker is also our sponsor. Baylor Scott and White Waxahachie was gracious enough to be our sponsor for this month's luncheon, as they have been for the last couple of luncheons, and they will be in November as well. Baylor took it upon themselves to sponsor several of our lunches throughout the remainder of the year, and I want to definitely thank Will and his team for doing that for us. And without any further ado, I'd like to introduce Will Turner. Will Turner is the president, right, of the Baylor Waxahachie Hospital, one that we are all very familiar with. And you know, his effort and his involvement in our community is really being made known. You know, aside from serving on various boards across the county, he's been very active up here in the Red Oak Chamber, and we appreciate the support with everything that they've done thus far, and we know this partnership is going to keep growing as our county keeps growing. So, Will, thank you so much for joining us today, and the floor is yours.
All right. Thank you, Clint. See if we can have a little bit of an echo. I think we're getting it there. And if technology will behave, I think Justin's going to share his screen here in just a minute. So bear with us. First off, I just want to say thanks for having me today, and hope to share a little bit, just kind of our experience in the healthcare space, obviously with COVID, and some good life lessons from a leadership standpoint, or maybe how not to do things. But then the other thing is just kind of what we see going forward. I know that so much of our lives have been impacted, obviously, because of a word that most of us probably didn't pay that much attention to up until 9 months ago, and that was the word pandemic. In our lifetime, we've seen and heard a few of these things that kind of come through, but it has not impacted us clearly the way that this one has, both from a business as well as a social and a life standpoint. So anyways, just wanted to kind of walk through a few things, but I thought I'd start off just sharing. The question is, how do you become a healthcare administrator? For those of you just dying to know, right? And so, I don't know that my journey is completely representative, but I thought it was maybe worth sharing just as we start here. So, my first job was at Enterprise Rent-A-Car. So, right out of college, management trainee. So. You think about every time you go to an airport and need to rent a car or get in a wreck and need a replacement. I learned some great life lessons at Enterprise. Let me just say that. And it was in Lubbock, Texas, washing cars in 110 degrees with a tie on, and then washing cars when it was 30 degrees with that same tie on. So from there, I moved on and went into sales. So I worked for Abbott Labs in pharmaceutical sales. My grandmother was long confused about that. She thought I was a pharmacist, not a pharmaceutical salesperson. So she would always call and say, can I take my fish oil with this or that? And I said, let me Google it. That's the answer to it. So From there, I joined Baylor Scott & White. I went back to school to get my master's in healthcare administration. So it's an MBA with a focus in healthcare, and that was in Waco. And I started with Baylor Scott & White down in our Waco hospital. So I have had the privilege of leading our Waxahachie facility here for the last almost 2 years, coming up on 2 years now. And so I think what's really important about our healthcare community here, if you will, and I'll talk a little bit more about this in a minute, is it takes a network, it takes a village, and as we continue to expand across Ellis County, for sure, just some really great stuff that we continue to bring, which is good for employment. It's good for future employers as they look to move to the area. It's one of the things that I know, especially big companies that have a state or a national presence, looking at new sites. They're thinking about, what are the education resources in a community? What are the healthcare resources? And can I find the workforce I need? So love to share a little bit of that. And so part of that is just an overview of our hospital here. So we have about 850 employees here at the facility, but we have almost 2,000 across Ellis County. So that includes, and we'll show you in just a minute, our very large Red Oak Primary Care Clinic. And then we have 2 in Midlothian and a large clinic here in Waxahachie. So, you just think about the business of healthcare. It takes a lot of people, from nurses and doctors and our cleaning team members, but also administrators, business people, all the different things. And so we are proud to be one of the larger employers in the county, and it's a part of our legacy. And so as a faith-based nonprofit, our mission in healthcare is really to serve our community. So we have no shareholders, no stockholders. So really what we do with our resources is continue to pour them back into the community to be able to offer more services. Obviously, this is a growing area, and making sure that what we can bring and offer to our community members continues to be the highest quality and continues to be of a varied variety. So you can see some numbers on the screen for those of you who can look. I think one of the things that stands out to me is when you factor in all of our emergency department visits, our surgeries, our outpatient visits, our clinic visits, we had 160,000+ people visit our campus here on the corner of I-35 and 287 last year. So very much obviously serve all of Ellis County as the primary healthcare source, but even people from South Dallas, from Corsicana, from Mansfield, really continues to be a hub coming to us. So getting down to a little bit more detail, one of the things we continue to focus on in becoming what I would call a regional medical center is adding services, so that at the end of the day, very simply put, we want the vast majority of people to be able to stay here in Ellis County and not have to drive into downtown Dallas. So my wife and I live in Red Oak. I can squirt across a Villa Road and go up I-45 and get into downtown, faster from this side of the world than a lot of my colleagues and friends that live north. But that doesn't mean I like to. So I figured out recently I got a new truck, and apparently my truck doesn't fit in the parking garage that I have to go to Baylor downtown, for example. So who wants to mess with all that? That's what I would say. So the great thing about that is we have a wonderful team here. So everything from a neonatal intensive care unit for our youngest babies that is under construction now. We will be bringing a heart hospital, a full advanced cardiac heart hospital here to Waxahachie over the next 2 to 3 years. But even things like orthopedics, helping patients with diabetes. We have an endocrinologist here. All of these things, in addition to things like our oncology service line, where you have some really tough diseases sometimes, and they can be really tough to go through from a patient perspective. You think about chemo, and I'm sure many of you have either had or known people that have gone through that. And so to be able to offer all of those things with the most state-of-the-art care here in Ellis County is really what warms our heart and fulfills our mission every day. So talking about Ellis County, sorry, this is in the hospital world. These things are badges of excellence. So I would say if our Ellis County Healthcare Group was a 5-star general, this would be a whole chest full of medals. And so it's basically a recognition from Magnet, recognizes our nurses. U.S. News and World Report lists the top hospitals. CMS gave us 5 out of 5 stars. I would say all of these things put us in the top 6 or 7% of hospitals across the entire nation. And so when we talk about quality and experience and excellence, Waxahachie really stands above even the rest of the Baylor Scott & White system in so many ways. So very proud of that. That's people that live right here in not just Red Oak, but our community. That's the work that goes on with our clinics here, but also the team here at the facility. And then again, speaking to healthcare across Ellis County, so much of healthcare is local. So I know for those of us that live in Red Oak, even driving all the way down to Waxahachie is just so far. So when you think about making sure that people have access to affordable, high quality, especially primary care, that's really where our mission sees us kind of spreading out across the community. And so there's a little, that's our logo that's up on the Red Oak site. So for those of you that don't know, off of Villa Road, there's a big development there. And so we have, probably 8 or 9 primary care providers and some APPs. And just making sure that people have access and can get in as our population continues to grow. One of the most important things is just, the routine testing, checking for oncology screening and heart and lung, all the stuff that goes into prevention, as well as, obviously when you're sick and you got the sniffles or, you might have COVID, obviously having those resources in the community is always important. And so I would just say, something that we continue to pour back into across Ellis County, not just with the hospital, but more importantly, our digital tools and our primary care, so that we keep people out of the hospital. That's really the future of medicine to the best we can do it. So moving along, let's talk a little bit about COVID. And I know everyone has heard more than they ever want to hear, but just wanted to give you a little bit of the latest from our experts and share some of that. And so, when you look at, there have been a couple of themes in this, and I think testing has been one of them that you hear a lot about. There are, the PCR testing is really the gold standard. So to bore you as an old science guy, it's polymerase chain reaction testing. So it's basically growing the RNA strands of the virus. We have been very blessed within the Baylor Scott & White system to have some great lab experts and to be able to get the equipment. And even here in Waxahachie, we are now able to run our own tests. So this is important as you talk about spread of disease and things like that. The earlier you can identify people that have it, obviously that gives you an opportunity to quarantine and prevent them from spreading it to others. So I think one of the challenges early on, obviously, was you saw some stories of people elsewhere, other health systems, other states waiting 5 and 7 days. At that point, you've kind of missed your window to really affect the health of people. And so even today, we see a positivity rate. So these are people that have, some sort of symptoms, coughs, colds, those things, between 10 and 20% ends up being actually COVID. So there's still a majority of patients that are having those symptoms that don't have COVID. So it just makes it more important for us to have those testing resources. And I would just say we are in great shape here in Ellis County. Our turnaround time on testing is about 12 hours. And so it's just one of those examples of having the right infrastructure in place, whether it's us or one of the other health systems, to be able to, treat our community, because at the end of the day, that's what it's about. Moving along, I know one of the things we've all heard a lot more about is our clinical trials and research studies. So we are very blessed, and I'm going to cheat a little bit in that we have some internal experts that are some of the best, not only in the country, but in the world. So the Baylor Scott and White system, we're able to sign patients up for state-of-the-art research trials. We do this regularly in a number of areas. Oncology especially is one of our biggest ones, where we have access to all of the latest experimental trial drugs through a number of our research initiatives. But our team pivoted quickly, obviously, as the pandemic took hold. And so we were the first healthcare system in Texas and in the nation, actually, to start using both the inpatient remdesivir trial. I'm sure many of you have heard the term remdesivir, but then recently the outpatient. So that is people that aren't as sick. And we were the second place in the world to start the Regeneron trial. So Regeneron and remdesivir, for those of you that follow the news, I would say, I'm sorry, because it's a crazy time right now. But more importantly, the president recently was reported received remdesivir and Regeneron treatments both. So we're so proud of our researchers being able to offer those treatments experimentally and recruit patients here in Ellis County and in Dallas County and surrounding areas with, again, some of the most up-to-date latest trials that are going on. The other thing I think is important, I know your businesses have seen that, and healthcare has been slow to get there. As they say, you're doing good if healthcare isn't 10 years behind the times on technology. And that is things like virtual care apps, virtual platforms. So our Baylor Scott and White app, for example, is one of the absolute highest rated apps on Apple for all healthcare providers across the country. So this is something that, as we bring together records on different platforms and help people navigate the complicated healthcare system, having digital tools on your phone is one of the greatest things we can do. So as COVID kicked up, this is one of the things we very quickly were able to develop a virtual screening tool. And so we've had over 260,000 people use this digital screening, which helped us connect almost 70,000 people across North Texas and Central Texas with e-visits is what they're called, where a physician, hops on kind of FaceTime sort of app, walks through your symptoms, and then can help you decide, do you need a COVID test? Does it sound like COVID? And then from there can get you to the closest, most appropriate place. So at the peak of the pandemic in April, when everything was shutting down, we had more than 80% of our clinic visits were being done over your phone. And so that's something that will stick around, I think, as the future goes. We all are very comfortable with using our phones and digital technology, and a lot of healthcare can be done that way as well. So our world is changing in healthcare, as it has in so many of your businesses. The other thing I would just share is our Safe Care plan. So I know there's a lot of noise out there. There are a lot of varying opinions, and absolutely respect everyone's personal decisions in their life. I would say with healthcare, we really put safety first, and so we have the luxury of kind of taking a no harm approach, which is that we are going to do everything we can do to prevent harm, whether it's in a surgical procedure for a patient on a normal day, whether it's an infection in the hospital, or most importantly with COVID right now. And so I think part of the thing I would emphasize here is that more than 90% of the care we provide, especially in this facility over the last 6 months, has been non-COVID related. So it is cancer, it is heart disease, it is stroke, it is all the other things. And so just assuring, our community, and as your businesses have done in so many ways, that it's safe. It's safe to, continue to get your medical care. It's safe to go to the grocery store, and it's safe because of the things that we all do collectively. So in this realm is what we call a culture of safety. So this goes from the person cleaning our waiting rooms and doing it regularly and at a heightened case, but also even our nurses and our physicians and what they do every day. So we have had a 100% masking policy, for example. Everyone that enters our facility, again, we have the luxury of healthcare and it being something that I think we all can stand behind, and making sure that sick and vulnerable people are receiving the absolute safest care. And with this, we have had less than a 1% infection rate amongst our team members. So these are employees by the hundreds and thousands across the Baylor Scott and White system that are in direct contact with COVID positive patients, caring for them every day. And because of the PPE and because of our insistence on masking with everyone, we have seen very few of those employees become positive. And I would just add that even the ones we do obviously went to grocery stores and visited family. And so the truth is, as you look at the data, masks are not something that's new for us in healthcare. We've worn them forever. My wife is a surgery nurse. Every single day of her career, she's got a mask on all day long. And so there's a reason for that from a healthcare perspective. And we are blessed to operate at the highest standards of safety again. And we've seen those results with so few of our employees converting to positive. So that leads into I think a larger conversation that has come up with the pandemic, and it's just making sure that whether you have one employee or 1,000 employees, your business would not exist because of those people and the people that support you. And so with the pandemic, it's kind of felt like it's all about work. Healthcare has felt this in so many ways, our healthcare providers and our first responders, obviously. And so, having a real conversation about stress, about downtime, about, taking those moments in a responsible way, but getting away from the work. So many people are working from home. It can all kind of run together with life. And so we continue to see from a healthcare standpoint, things like mental health, addiction, abuse, those sorts of things are a real concern. And I do feel like, unlike myself, we can often walk and chew gum at the same time, as I was saying early on. And part of that is to both tackle the pandemic, but also make sure that we're taking care of each other and that we're having those conversations with the teams that we might lead, and again, the people that we work with to make sure that we are recharging those batteries where we can. We're leaning on our families, and in some case, we're getting help if we need it. So always a focus area for us, and I think never been more important than now. Our faith is sometimes challenged, our being able to worship in person and those sorts of things, and so it's just always important in life to focus on that. So that leads us back to something that I'm sure none of you have ever heard, which is just a continued focus. I think that there is real fatigue. I know our healthcare providers know all the studies, know all the ins and outs, but it can just get tiring after a while. The message of continuing to wear a mask when you're in close contact, physical distancing, and washing your hands a lot. So these aren't hard concepts. They are time tested and true. But honestly, I think we all struggle with continuing to maintain that vigilance. But it has never been more important than over the next 3 months. As the winter comes on, we see a lot of illness every year anyways, whether it's flu or just general respiratory things. We're all indoors because the weather's nasty like it is today outside my window here. But it just makes it more important to especially protect the vulnerable amongst us, limit the spread. And so I always like to take a chance to share that. So as we start to get towards the end, the question comes up, what does the next couple of months look like? What are our hopes? And so I would say there is a lot of hope. A couple of things. Our clinicians have gotten much better at managing COVID. So those amongst us that are sickest, we've got a few more indications about why some people, even people young, people in their 20s that have been here in our hospital, that are critically ill. There's still a lot of mystery around why some people do really poorly and most people do not. We've had even people that are a little more experienced, so in the older crowd, if you'll forgive me the term, that have done fine, that you would think would be at risk. And so at the same time, we are currently a little bit limited still in what we can do. So I mentioned some of the experimental things that are being looked at. We have access to a lot of them, but there has not been a lot of proven stuff. So the vaccines are kind of the latest thing you hear a lot about. The vaccine is meant to create an antibody response, is what it's called, in your body. It will not prevent you from getting the disease, but the hope is that with the antibodies, you will either not see symptoms or see significantly diminished symptoms. And so, I do have confidence in the experts that do this. Again, we have a lot of system experts that work in this space. That first off, what is approved will be safe. It will be effective. And yet, at the same time, I would just caution that nothing is ever 100%. And so it's hard sometimes because I think we get focused on our world and looking for absolutes. But even a 50, 60, 70% reduction in symptoms, over time with enough people getting vaccines, for example, this can help us control the virus and hopefully eventually it to get snuffed out. And so, we've seen some of this history 100 years ago with the Spanish flu. You've heard a lot about that. It was around for 2 or 3 years. They really did not have the technology that we have today to develop therapeutics and vaccines. A lot of times you would see it in waves, as we've seen a little bit here. And so there were 5 or 6 waves kind of reported across the country over those 3 years until it finally petered out. And so we are very hopeful about vaccines. Again, I think the best case scenario, your healthcare responders, your first responders would be having access to some of the earlier ones over the next 2 months, maybe December, and probably the larger population as we get into 2021. So again, lots of hope. The other piece, and I mentioned remdesivir and Regeneron, are what we call therapeutics, if you will, medicines. And so there are some additional things that some of them create that same antibody response as you do get sick, kind of getting treated after the fact. But some of them stop the virus from replicating. So there are lots of great things coming. I would just say I have a lot of confidence in the experts that do this every day. I know the news and politics can really make things messy, but we work every day with some amazing people, even within our system here, that really are experts in this field. And I do have a lot of hope over the coming months that we will continue to be able to tackle this in a meaningful way. So the last thing I would share is just a little bit of leadership. And again, I am by no means an expert, but I think this has especially been a trying time for our healthcare teams. And so there are 3 things really that have been most important from my perspective and our perspective. So one of them is that your voice is more important than exactly what you say. So not hearing whether, again, you have 1 employee or 10 employees or 1,000 employees. It's easy to kind of close down. Psychology and science will tell you that in the midst of a crisis, your vision narrows. You focus, on your immediate needs and your immediate family. But your team members and again, the people you interact with, your customers, they're feeling that same thing. And so hearing from you is always important. Presence, again, is more important than presentation. So, and then lastly, clarity is the next best thing to certainty. So I think for us, again, in healthcare, we didn't have the masks and the PPE we needed early on. We didn't know a lot about the virus. We were still trying to figure out. And so we use the term pivot, and it is a word that I just cringe when I hear it now because we've used it so much over the last 9 months. But it's basically, the world changes and we don't have all the answers. Admitting that we are doing the best we can, But I think just getting out and obviously, talking to your team, talking to your customers, pulling together as a community. I think that's one of the things that I love so much about Ellis County is even though we're growing, even though we have, over 200,000 people across our county now, it still does feel like a hometown, a small town. People care about each other. We're here to not just in healthcare, but in business and everything else, support each other. And those lessons have never been more apparent and been more true than as we've worked through this challenging situation. So I would say as we end here, I'm happy to answer any questions. Whether you're in any kind of business, I think this does challenge leadership, and leadership again does not require any set number of people. It could be your customers, it could be the people you're interacting with, but it's always important to take those moments away to breathe. There is hope. We've learned a lot. Lean on our, especially our local healthcare experts, physicians, whoever that might be for you. And just know that the people that are in this field and in this community, really doing the best they can. We have some wonderful experts around and always here to help support each other. So at that, I will stop there and happy to answer any questions. And again, you might get clarity more than certainty, but always happy to take a shot at things.
I have a question.
Sure.
Yeah, you cited a statistical earlier. You said that a certain percentage of cases that are in the hospital right now are not COVID related. Was that 60% that I heard?
No, since the pandemic started, more than 90% of the patients we have treated are not COVID. So I think the big message, I would say, it's not that we don't have COVID. We do, and it has definitely been going up recently. So fair warning, everyone, please use your mask and wash your hands. But what you saw, not just here, but across the nation, are people, for example, having chest pains and saying, well, I'm too scared to go to the hospital because I might get COVID. And some of those people, unfortunately, were having heart attacks. Which obviously I don't think you have to be a medical expert to say that, there is a much greater danger from a heart attack that is currently ongoing as compared to, the potential for COVID. We have not had a single case of COVID transmitted from a patient that came in without it to another patient. So we have no examples of anyone that came in suffering from a heart attack or a stroke or cancer that has gotten COVID at the hospital. So we feel very confident in our safety, but again, it's really just that message of whether it's your cancer screenings, any of those sorts of things, but even acute symptoms of other items. There is definitely a priority when it comes to your health, and so a big chunk of that is still not COVID.
Well, and that's interesting to know, and I'm glad. I don't think that needs to drive the narrative of how people need to be behaving, but it's good to know that this is manageable as a society. And also, thank y'all very much. Y'all fixed up my ankle when I broke it, and Dr. Martak over in Midlothian's wonderful. So.
Oh, awesome! I'm so glad to hear that. I have the distinct privilege of not having to poke or prod anyone, which is good for everything. Instead, we leave it to some really wonderful physicians and nurses here. So
you've got a lot of good ones, especially in that family care facility over in Midlothian, where me, the kids, all of us, we have good experiences there.
I am so glad to hear that. I didn't mention this specifically. I think one of the challenges we have is just so much population growth, continuing to hire doctors, which there is a national shortage. So our clinic has doubled in size over the last year. We continue to recruit doctors. We opened a brand new, we call it Midway, which I have learned is a clinic that is midway between Midlothian and Waxahachie. Now. Yeah. As a new convert to the community, I was like, those two kind of run together. So I don't know that there's a midpoint, but it is by the water.
Don't tell those people that, dude.
Yeah,
There's
don't tell them. But yeah, our Midlothian and Waxahachie Clinic both have been here since the mid '80s, and I think Red Oak was founded maybe in the early 2000s was kind of the time frame. So I'm so glad to hear that.
Good deal. Well, thank you.
Yeah, thank you. Any other questions out there or thoughts?
Will, does getting the flu shot have any, does that help at all towards COVID or just the flu? Do you know?
Yes, it does. But let me tell you how. We don't know what's going to happen if, for example, you had both the flu and COVID, which is totally possible. There is definitely a concern that would be a double barrel loaded shotgun. I think the bigger concern for us as a healthcare system and especially locally is normally when the flu season starts every year, it's usually December-ish, but as late as January or February, where we're seeing 20, 30, 40% of our patients in the hospital that are flu. And, you know, all the complications that go with it. And so the concern is that if flu has even a normal year, but especially a bad year, and you have that same percentage of COVID patients, then we are all over our capacity. So we really, you know, healthcare, especially here in Ellis County, as we've grown with the population, you know, it's not like we have we're using, you know, 80 or 90% of our capacity most of the time, just because, you know, it's very expensive. And so our concern, not just here locally, but everywhere, is that if we can minimize the flu season as much as possible, it will keep beds available for, you know, patients that might have COVID. And obviously just, you know, the flu period is always a disease that we try and minimize. So, and I would just comment, for example, 100% of our providers and employees have already been vaccinated. We had a deadline of last Friday. You know, it's just one of those things that even if it's only 30% or 60% effective, I hear a lot of people that say, oh, well, you know, I took the shot, but I still got the flu. You will see two things. One is usually a minimization of symptoms. But the other thing is that even at 60%, you're talking about 60% less spread across the country. So that translates to us in the hospital and, you know, a fair number of beds. So again, just can't advocate enough for those that are appropriate. You know, the flu shot is not a bad thing, and it will really help, I think, everyone in the long run here.
Well, I've never had a flu shot, but on your recommendation, this may be my first year.
Oh, goodness. Well, thank you.
Second question,
Sure.
If, you know, God forbid that we do have a bad year for flu and the COVID does increase in numbers in the winter, is there if you reach capacity in the hospital, what's next?
Yeah, it's a good question. I would tell you, we have done a lot of work around, I would call surge and contingency planning. And so, you know, the truth is that we are still very capable of caring for patients. So some of the steps you see is we stop doing surgeries and things that can be put off, and we transition our surgical nurses over to help care for patients. We are blessed, as most newer facilities for sure. Our rooms are big enough for double occupancy, like you saw back in the days, but we never do that. You could do that, so you know, you would double up potentially, but you know, it's all of those things are less than ideal, and you know, I think we can understand that, and that's fair to say. So right now, I will tell you the El Paso region is really in a bad spot. The state has come in and helped them. They're actually flying patients on fixed wing aircraft across the rest of the state. So we aren't getting in one locally, but I would tell you a number of our Baylor Scott & White facilities are going to be taking patients out of El Paso. So that's the other thing, is between our Judge Little, our county government, and our emergency management. You know, we have a great network across the state. There are other healthcare colleagues and providers to do our best to manage, but truthfully, again, I think, you know, can't say enough. Our the point where we start to sweat is if you get so much spread that there's not you can't move from El Paso to Dallas, because El Paso and Dallas and Houston are all really running, over capacity. So rest assured, we are nowhere close to that, and we have lots of contingency planning. But the challenge is when we start to see it, it happened 4 to 6 weeks prior. So it's what happens today will spread and spread and spread and spread, and then really starts to come in, and we see it, a month from now, kind of thing. So that's why we say all that. Any other questions? And again, Clint, thanks for having us today. I think it's hopefully a good timing to share some of this, and I never pass up the opportunity to put in my public health good tip.
Right. No, and I agree with that. I think this is great timing. And good message, because we're all still kind of different stages, but we're trying to figure out how to transition out of all of this. And so I do have one question, and this might be kind of putting you on the spot a little bit, so I'm sorry if I do.
I did vote. That's your question right here. No.
Yes, you did vote. Good. But no, we've heard from the media so much. Obviously, this dark and dreary sound, and kind of when I talk to you and talk to some other health officials, it's not as bad. Kind of you hear the back and forth quite a bit. One thing that was really eye-opening to me was when we talk about capacities. And there was a while there where we were hearing, all the COVID beds. That's we're at 75% right now in the county, and of course it was eye-opening to me when I found out, well, that number is really only this many select few beds. And so I kind of, to put you on the spot, go ahead and talk a little bit about that and how it's kind of, I guess, not as bleak of a picture when you, from your perspective versus what we're hearing from the media.
Yeah, sure. I'm happy to share that. When you look at the big picture, there are 200,000 people in our county or north of that. I don't know what the latest numbers are. And our challenge is we have 112 adult hospital beds here. And so on any given day of that 112, we have somewhere between 70 and 90 of them full of stuff. So by stuff, I mean, infections, heart attacks, strokes, surgeries. Yes. And so it's not like, we have to be efficient as stewards of the resources we have. So it's not like I've got 200 beds and I've got 80 of them filled and I got a whole tower just sitting here ready to go. Right. The other part of it, really, our biggest pinch is nurses. So I have to have one nurse for every 4 or 5 patients. If you're critically ill, I have to have 1-to-1 or 1-to-2. So just to give you some perspective, in July, which was our last spike, July is normally not a sick month. So we don't have a high number of patients anyways. And yet I had half my beds filled with COVID. So that was okay at the time because I didn't have a lot of the other stuff. So right now I've got about 20% of my beds filled with COVID, 20 or 25%. But if that number gets back up to 50% or 60%, then I'm over, because if I normally have 80 and I've got 40 or 50 COVID patients, I'm suddenly over what I have available, and I have to figure out the next step. So I think really you're right, and so much of what we do is not COVID, but it's again, it's just the challenge of where do we end up here. And I would just add one more thing that concerns us. So the staffing is really probably our biggest concern on having availability. And so if 30% of my staff, for example, is sick because it spread so much in the community, then I can no longer fill all those beds. So it's just, again, it's how you project out and whether you're right or wrong. And unfortunately, I'd rather be wrong and prepared than right and unprepared. So.
Yeah. Well, and thank you. I kind of took you down the trail there, but like for me, it was, hey, ICU beds, we're getting full on this, and you look at it and it's like, well, our ICU bed count is what, 15, 16, right?
Yeah, I think I think this has 3 or 4. We've got 12 and really can go up to 24.
Okay.
Pretty comfortably. So the
And
challenge is when my 24 are filled, usually Baylor downtown is filled, and Baylor Plano is filled, and Waco is filled, and so what we never want is that what you saw in New York, frankly, is there were way more people than they had resources, and people did not get optimal care. I'll just say it that way. I'm not saying it was bad. I'm not saying it caused them to die. But we always, we know what the optimal setup is, and that's what we're trying to stay within.
good deal. Good deal.
Any other questions? I know we're running late on time, but really appreciate everyone joining us today, and hopefully you learned something, good or bad or indifferent.
No, absolutely. I think there's plenty of good, and thank you again, Will, so much. Not only for your topic today, but for your support of the chamber, and we appreciate all y'all do, and continue to look forward to working with y'all in the future.
Yeah, I will. Let me just end with we are always honored to serve. So I am always happy to help with anything. Clint knows how to get a hold of me if we need to, but we're just our team and everyone. Most of us live in this community, and we are going to be announcing because of our bright future about a $50 million expansion of our campuses here over the next 2 years. So. The system is very supportive of what we've done here in Ellis County, and that'll continue to mean more doctors and more support for Red Oak and our employers, and more people to buy stuff locally. So we're just so blessed to be a part of the community, and thank you, Clint.
Absolutely. Thank you so much. Well, we're going to jump into kind of the last part of the luncheon and talk a little bit about some of the things we have going on. We do have some big irons in the fire coming up. And we definitely want to make sure that y'all are aware of it and participating however y'all are able to. First of all, as Barry mentioned in the very beginning, we are getting ready for our auction. It is rolling into the holidays, the theme this year. Obviously, unfortunately, we can't do our usual black tie event with our live auctioneer and whatnot. And I know that's somewhat discouraging, but at the same time, the event is still happening. The auction is still happening. And we found this great platform, this online company that we've been working with. And the benefit to us here at the chamber, while we are able to add some of our own items as we get them, they provide a whole bunch of the items themselves. And what this means is that takes a lot off of our plates here at the chamber as far as making sure we have time to go out and get stuff numbered and itemized and getting ready to find out what the bid price is. And a lot of that's already done. Now, the other benefit to this is it is an online auction. So that means it can expand past our Ellis County friends. And me personally, I know a lot of my family's going to be jumping in from New Mexico. And so how does that work for the online auction? Well, this company actually does take care of the shipping aspect as well. So relatively, for the most part, with the exception of the items that are donated directly to the chamber for the auction, we're relatively hands-off. They take care of a lot of the ins and outs, and that really makes it an easy, beneficial event for us. Now, we are still in the process of selling some sponsorships. We do have 2 sponsorship levels. They're simple. They're both low cost, and it's got some great marketing opportunities, not just for the auction event, but for social media and beyond. So we appreciate everyone's support. The auction itself will be on November 5th, and it will last till 9 o'clock on November 8th. So there's plenty of time to get in there and bid on some of the items and get in bidding wars with your friends across the county, or hey, maybe someone from California. You never know. But I encourage y'all to log in, participate, and definitely share the information out. Definitely get the information out. Usually this event, we have 120, 130 people show up in the ballroom at the city building. If we put this on Red Oak Talk, if we put this on different social media outlets, or tell our friends about it, our family about it, who knows? We could have upwards of 1,000 people or more even participating in this. What could that look like for our chamber? And so I encourage you all to spread the word on it. and tell your friends, hey, let's just support this great local initiative that helps our businesses grow. And so I thank you each and every one for that. Barry also mentioned in the beginning that we are looking at our election cycle for the chamber. Every year we do select new board members. This year there is 5 open slots. And so altogether we will have 9 people running for those positions. I sent out an email earlier this week with a list of all the 9 people, a little bit of bio about them and talking about them. And very importantly, the auction will start on November 2nd and last till November the 13th. The way you vote is you pick the top 5, those 5 people that you want out of that list of 9, and send that to me in an email. Just, admin@redokeareachamber.org, and just say, hey, these are the 5 that I vote for, and we'll tally up the votes and we will make the announcements that coming Monday as far as who gets elected. And just for note, it's 1 vote per business. So, you can't have Will send in votes and then Justin send in votes. So it's just got to be 1 person from the business. So one last thing that I want to highlight for y'all. Obviously, Halloween is coming up. We've got lots and lots of things going on. If you've seen in the newsletter, there are a lot of businesses that are having some variation of trunk or treat or drive-by candy pickup and whatnot. One of those actually will be having the ribbon cutting at the same time. One of our newer members, one of our newest platinum members, Therapy Ops, on Halloween morning at 11 a.m. is going to be doing their ribbon cutting. They're having a fall festival after it, but we definitely want to come out. I know Saturday's kind of a weird day for ribbon cuttings, but if anybody is available Saturday morning at 11 o'clock, come out and cut the ribbon with us at Therapy Ops. It's located across the street from the high school, and they will be having a big fall festival afterwards. I've got my kiddos with me, my 4 and 7-year-old. And so after I cut the ribbon, we're going to participate in the fall festival ourselves. And so maybe that's a segue, a good way to be able to participate. But I hope to see a lot of y'all out there. Other than that, that's about all I have. Keep looking for information from me. Most of you have noticed that I've started sending out our newsletters in a little different format. But the good thing is it's not getting caught up in some of these email filters like Barracuda and some of these other ones, and it's getting through. So if you have not received an email from me in a while from the chamber, go ahead and reach out, give me a call, and we can find out what the disconnect is, and we want to definitely keep you all connected here with the chamber. Other than that, that is about all that I have for today. Anybody else have anything? Actually, you know what? I do have one more thing. I see Mr. Stan Lewis on the call, and I want to give a shout out, some recognition to Stan. For those of you that were able to participate on October 9th, which happened to be my birthday also, was Live to Lead 2020. And for those that have participated in Live to Lead in the past, it's a great event. You get to learn some great things from some of the top leaders in the world, frankly. And this year, Stan was gracious enough to give the proceeds to the chamber for in support of what we do, and I'm kind of at a loss for words because it's such a great, generous thing that he did, and obviously tons of appreciation for that. We ultimately had, I believe the final number was 910. Is that right, Stan?
Yeah, that was correct. $910.
We definitely want to thank you for that. That's absolutely generous, and again, I'm speechless. The Red Oak Education Foundation was a recipient last year, and we're blessed to be the recipient this year. And it's because of community things like this. Helping the community out, and we, helping out in a down year. We know that this is a year that we are struggling a little bit. So, Stan, I definitely want to publicly take the time to thank you again for this. I appreciate it. And I'll let you talk on it a little more, but I believe there's another round of Live to Lead coming out. They're still doing another broadcast coming up
Yeah, there's a broadcast in November and December that if anybody wishes to attend, let me know. Because if you're attending and you're a member here of the chamber, those proceeds, all of the proceeds, not a portion, all the proceeds go to the chamber. It's been rough this year. A lot of events we normally would have, the chamber would do, it's not been able to do. So that's cut back on their revenue generation, and just thought that this would be a way to help out, a little bit. It doesn't take care of everything, but every little bit helps.
Again, thank you so much, Stan. I'm at a loss for words. I appreciate it more than I can describe. So
Would it be okay if we gave Stan a round of applause for his generosity?
absolutely.
Well, it's appreciated.
Thank you. Thank you again. I appreciate that very much. Well, folks, that's all I have today. We are sitting at 57 minutes right now. And so I appreciate everyone jumping on. Will, thank you again, not only for the sponsorship of this luncheon, but as well as bringing us a good topic. Obviously some great information to have. Don't let our guard down. We're at a low point, but that doesn't mean it's going away. So I appreciate it, everyone. And well, here, let's go around the room real quick like we usually do, and just kind of tell everybody, say your name and business, and we'll go ahead and start with Mr. Barry.
Barry Moore at Edward Jones, right on Ovilla Road.
Perfect. Chuck and Mary. You're on mute, Chuck. I can hear him. He's in the other room. So hold on, Chuck. You're on mute. Maybe.
There we go. Finally got it. I'm sorry, my mouse disappeared on me. I'm sorry. But I was saying, in case any of you did not recognize, we're gearing up for trunk or treat at Hampton Road Baptist Church on Saturday afternoon. And so we're going to have a great time. If you got little kiddos in the neighborhood, have them come by the Hampton Road Baptist Church. We're going to have a fun time with them.
Chuck, you never look better.
Thanks.
And here, Clinton.
I don't think you can see Mary's picture. She didn't want to gear up for it on this call today. She said it'd mess up her hair, but anyway.
All right, Miss Karen Finn. Oh, you're on mute.
Oh my goodness. I think it's going around. Okay,
Right.
I'm Karen Finn. I'm with KJ Content Marketing, and I help businesses get found online.
Perfect. Miss Holly Jones.
Hey, Holly with Interbank. Glad I was able to join today. Haven't been to many of these, but very interesting talk. Thanks, Will.
Thank you. Appreciate the support. Miss Sharice.
Hi, I'm Sharice. You can't see me, but you can hear me. I'm with Now Magazines, and we have 4 magazines in Ellis County. So if you want to get your word out to all of Ellis County, we're the magazine to put your advertising in. And thank you.
All right, perfect. Logan. Oh, the mute bug is back again. Logan, can you hear us? All right. Well, we'll go ahead and go on. Logan from the Red Oak Public Library, of course. Beth?
Hey, how you guys doing? Thanks, Will, for so much. I'm Beth Trimble with Red Oak ISD. But thank you, Will. Great update. And We love getting your updates through Todd Little and the county judge as well, but we know that you guys are doing a fantastic job and we love our clinic here. So thank you so much.
Perfect. Thank you. And last but not least, Mr. Stan Lewis.
Stan Lewis, Inward Journey. Just
Perfect.
happy to be here.
Absolutely. Thank you so much. And we did have a couple people that were on and kind of jumped off. I know I saw Charles from Linebarger. And of course, Linebarger is actually one of the sponsors for our auction as well. They're our presenting sponsor this year, as they have in many years past. And so I appreciate all that they do. Folks, thank you so much for everything today. Look forward to seeing you around our community in the next coming days. Have a great day.